Many thanks for rejoining us again. And the program is Good Morning Abuja, coming to you from the Unity Station NTA Channel 5 Abuja. And now we have another guest with us in the studio. And this time around, we want to talk about how we can detect and prevent infectious disease early enough. And we have with us here this morning Dr. Chukwugoze Ujam. He is the Deputy Director, Community Prevention and Care Services, NACA, which is the National Agency for the Control of AIDS. Doctor, you're welcome to the program.
Thank you very much.
All right.
Thank you. And good morning.
Good morning. Good to have you with us on our program.
Thank you.
Okay, we are talking about infectious diseases, how we can detect it and prevent it early enough. Let's start. What are infectious diseases?
Okay, so thank you very much.
You're welcome.
Thank you. I'm really honored to be on your program. So infectious diseases are, shall we say, we'll define infectious diseases as diseases that cause any disorder that's
Okay.
caused by microorganisms.
Okay.
And these microorganisms, or indeed organisms, can be bacteria, can be viruses, they can be fungi. Okay, so these things essentially, when they can be normal in the human body, but if there's any sort of immunosuppression, then
Okay.
it can manifest.
Okay.
I think that we need to make a distinction between infectious diseases and things that are contagious.
Okay.
Okay.
Let's go ahead, right?
So things that are contagious. So because you can imagine that malaria is actually an infectious disease.
Wow,
Because
malaria.
yes, because it's caused by because these things can be caused by insects. Yes, so but there's a method of spreading. So you can have a person to person spread. You can have animal to person spread. You can have a mother to an unborn child spread of, sort of infectious diseases. So, I think the thing to mention is that these are just disorders that are caused by organisms. Yes,
Okay,
which,
that's a very good one. Okay,
yeah,
talking about this infectious diseases,
yeah.
let's talk about the symptoms. How will you know you have these diseases inside of you?
Okay, so in the early stage, it's difficult to know whether or not you've got an infectious disease. But remember, I talked about if your immune system is a bit suppressed.
Yes.
Okay, that is an extreme. But by and large, the organism itself would have started to take effect on your body. So you may exhibit things like fever, for instance, and that is a rise in temperature of the individual in question. You may start to experience maybe muscle pain. You may start to experience a bit of a cough or a cold. And we call these things premonitory signs. They're signs that the individual will exhibit, and I think this person is coming down with an infectious disease. Yeah.
You know our attitude here.
Mm.
You know our attitude here.
I think
If
I
you
do.
have if you start feeling some of the symptoms, you go and do some personal check. You're taking some tablets, and that's all. How do we? What do you have to tell them if you're noticing anything of such? What are we supposed to do?
Yeah, and I take the point about our system in this country. One of the things that we as medical professionals encounter is late presentation. So I take on board what you're saying.
Okay.
I think that one thing that I would pass across as a message is if you're feeling unwell, just go and do a test. Because what we do in this country is that we like to self-medicate,
Self-medication.
which is improper, if I may say.
Okay.
So I think that people should go and do a test. Not everything is malaria and typhoid, because the number of results I get, they say I've got malaria, I've got typhoid. It's not strictly true.
Okay.
Okay, because for instance, if we take malaria, if you check, 100 people in this country, because it's endemic, you will find 1+. That doesn't mean the person has malaria. Do you understand what I mean? It's not coming down with a malaria infection, but people just, oh, I've got knee pain, it must be malaria. I've got toe pain, it must be typhoid. That sort of thing. I think that people should go and test in a laboratory, a government approved lab, and get a result, and then you can see a medical professional for advice.
Okay, I know your field, you have a lot of involvement with the community.
Yes.
Yes, people. How do we relate this? What message can you preach to them? Talk to them on how not to do self medication and how to take care of their health very seriously?
You know, changing the culture of people is difficult. I know that. But the message is, healthcare is relatively cheap. I know that there are expensive outlets there, but going to see a medical professional in your community is important. Rather than you misdiagnosing yourself and taking tablets or injections that you do not need, you find people going into a pharmacy with a list of what they want rather than it being the other way around. You go on with a prescription. So I think that in the community, if but my message is once you start to feel unwell, just go get tested, really, so that we can get a proper diagnosis. It helps rather than
because that is what is their innovation is about herbs.
Yeah, exactly. And these herbs, I'm not saying that they don't work. They probably do, but they haven't undergone quality control. And whilst they do, you're not even sure shall we use the term dosage that one should use, or ingest, because you can go and damage your kidney, damage your liver, and then you'll come back with something that is worse than what we could have tested and treated initially. So the message out there is please don't go taking medication if you've not tested yourself for any kind of infectious disease that you think that you have.
Okay, let's talk about technology. We all know that innovative technology has really changed healthcare delivery system. Um, what is the role of technology in preventing and treating these infectious diseases?
Okay, so when we talk about prevention, um, I think there's a couple of steps. So you've got the prevention, you've got early detection.
Yes.
Right. So in terms of prevention, there are numerous things. So for instance, going by or along the terms of what we've been discussing, like malaria, before I move it on to where I work, obviously in NACA. But malaria, for instance, what's the prevention? Mosquito nets, isn't it? For things like HIV, because that is an infectious disease. There are preventative things that one ought to do. If I were going to zero down into obviously my forte where I work in the National Agency for the Control of AIDS, it's more the first thing is abstinence. There's no other prevention than abstinence, And then if you must engage in sexual activity, we always preach the use of condoms. So those are preventative. But I think that probably the question that you want to ask is about early detection. And there are equipment that is freely available, and we call them point of care in vitro diagnostics. So even for malaria, you've got these things that you can buy off the shelf, and you can test yourself and see whether you've got two lines. It's a bit like a pregnancy test. So again, not that pregnancy is an infectious disease, but it can be detected early. Exactly.
Yeah.
So you've got things like that for malaria. You've got things like that for HIV, for instance.
Okay. Yeah. Okay, now that you are here, just quickly talk to us about the place of point of care in vitro diagnosis.
Okay, thank you very much. So, with respect to point of care, and what that does is that you can take the test to the community.
Okay.
Because these things are, sort of, they're not rocket science kind of things. You don't need to go into a laboratory. You've got these little setups that you can just do a quick. I think that the advantage of these points of care things is that they're quick, they're minimally invasive, and the turnaround time is just next to nothing because you can get the result 5 to 10 minutes, 20 minutes maximum. So the idea is that it's free, well, not freely, but it is widely available in the community.
Okay.
And people can get themselves tested for certain things, like I've mentioned before, malaria, HIV, those sorts of infectious diseases. They can be tested through these diagnostics.
We know that HIV and AIDS is very much around. And what's your message on still this early detection and prevention?
Okay, so again,
or you want us to separate
yes,
the two?
I think
Okay,
that we
early,
need to make that distinction
early,
because
early detection.
Right now, I think we need to focus on prevention.
Okay.
Partly because HIV goes through a a window phase. So in terms of early detection, I think that if you're positive, you're positive. And the thing is that when we talk about early detection, it's about just quickly placing you on treatment.
No miracle can happen.
Well,
that's just
a
side of it. All right, go on.
In terms of prevention,
Okay.
yeah, so the country has or supports programs in which there are largely 5 programs that we support. So along the lines of prevention. So the prevention, we call them pillars, prevention pillars. The first is the condom program.
Okay.
And these programs focus on groups of individuals who we want to help prevent the spread of the virus. So you've got the condom program, you know, everybody knows that if you use a condom, it's there to prevent the spread of not only HIV, but other infections, you know, like hepatitis.
Okay.
Yeah. So you've got the condom program, you've got the adolescent and young girls. We focus the program on them because we know that they are a group of interest.
Yes.
And saying that, from my perspective, we also have the adolescents and young boys because we don't want to forget them.
I'm very much interested in this program for the adolescents and young boys.
Yes, we'll talk about that.
Okay.
If I mentioned the other two, the other two have to do with the key populations, and then there are the last one has to do with biomedical programming. And in the biomedical, you've got pre-exposure prophylaxis and you've got the post-exposure prophylaxis. And if we're going to say that you want to detect something very early, it's about if you think that you've been exposed, that you want to go on to post-exposure prophylaxis. The final thing we don't really focus on because we're doing very well in that has to do with male circumcision. So so we don't really want to go down that route. It's about focusing on these other areas in terms of
the first two. So talk to us more about the adolescents and young boys.
Okay, so we know that male by themselves they have poor health-seeking behavior, or attitude. So for the young boys, we focus programs directed at them to engage them because we know that they can easily slip into dangerous habits. So you want to prevent them from going into drugs. So you want to keep them engaged. So the programs that are focused towards them or at them to get them engaged and sort of keep them on straight and narrow. So we would be telling them about respect for the opposite sex, respect for themselves, condom use. We'll be telling them about alcohol use and abuse, those sorts of things, and how to I guess how to be responsible. And those are the programs that we would sort of focus for those
okay.
And also about employment for them, because if you can't keep them gainfully employed, an idle mind. What they say is the devil. Sorry, yeah.
Okay, how often do you take this program to the rural communities? We keep talking about rural communities because we know that information is light. How often do you take this program to them?
To be honest, we take it to them fairly regularly. In the 36+1 states, we've got organizations, what we call CBOs, who are empowered to do these programs, and we have targets that they're given to make sure that they achieve or attain, or reach a certain number of people, whether it is the young boys or it's the young girls, whether it's people in the key population, whether it is, in terms of the number of condoms that have been distributed, or the people who are in need of pre-exposure prophylaxis or post-exposure prophylaxis.
Okay, quickly before we go, I want you to advise us the final words and any other thing you want us to know about early detection and prevention of infectious diseases.
All right, how many minutes have I got? I'm just joking. So I think that the message out there is that you need to, in terms of prevention, you need to practice safe sex if you must engage, because the first thing is abstinence. With abstinence, there's nothing that can go wrong. In prevention, if you want to engage in sex, please use a condom. And regularly test yourself. If you think that you may have advertently or inadvertently become exposed to the virus, go and get a test quickly. We can place you, depending on when this exposure happened, we can place you on medication.
Thank you so much for your time with us this morning on the program. All right, we do really appreciate your time. Okay, we've heard it all from the voice of Dr. Chukwugoze Ujam, who is a Deputy Director, Community Prevention and Care Services, NACA. And together we talked about early detection and prevention of infectious diseases. Please, let's take our health very seriously because our health is our life and is our wealth. Now let's go on this quick break. When we come back, we have more for you. Stay with us, please.